Well, welcome back to Ally Academy Northwest. I'm Dr. Jeremiah Peck, and today I have the privilege of being joined by Jocelyn Fitzgerald. Jocelyn, welcome.
Thank you.
Now, Jocelyn, you're a licensed marriage and family therapist. You are a registered art therapist. You're also a consultant for eye movement desensitization and reprocessing, or EMDR. And you co-authored and co-edited the book EMDR and Creative Art Therapies. So I'm very excited for our conversation today and for you to just tell us a little bit more about this unique intersection between art and expressive therapy and EMDR and trauma.
Yes, well, they are a beautiful marriage and they go together so well. So EMDR is a modality used for trauma where you activate an image. What was the image? What was the worst part of that experience? Or if you're doing a resource, what was the best part? So you're using your imagination to create an image. And with art, you're using a tangible physical image where we're either creating with paint or pens or sculpture what it is that we're working on. So they really come together quite nicely. EMDR, we activate the image with our imagination, and then we ask a series of questions like, what's your belief? What's your cognition? Where do you feel that in your body? How intense is it? 0 to 10. And then you do these rapid eye movements or you do bilateral tapping. And you can do the same thing with art too, where you ask about the art. What was your experience like? Create art around it. What do you notice now? Can we recreate that image in a way that feels different or more empowering? Um, but what we've learned through this book, through our practice, is a bunch of art therapists around the world came together and we were like, gosh, we're all doing similar things with bringing in the arts and the bilateral movements that EMDR uses. And we're getting grand slams with these two together. We would sometimes get a great experience with just the art and sometimes with just the EMDR, but we found that the magic was really happening in bringing the two together.
Yeah. You talk about, use the word grand slams or magic. What are some of the highlights of combining or really integrating these two approaches, two modalities? What have been some of the results or areas that this really works really well in?
Yeah, well, I guess tell you a story about clients that I've worked with. I've had clients with medical trauma. I had one little girl years ago who had all this medical trauma, and I was like, "Can you create a metaphor? What does that look like? What does it feel like?" And she created these like underground caves with these intricate walkways with spiders and then ladders that were missing prongs, and so she could really use the art to express what it felt like to have this physical illness within her body. And then we could take the EMDR and do the eye movements, and she could have a new understanding, a sense of ownership over what she was experiencing. And she could take the art, and then take the desensitization that came from the EMDR, and she could explain it to her mom in a way that her mom could finally really understand what it was like for her daughter to go through this medical trauma, where she wasn't completely flooded and overwhelmed with just even sharing a little bit about what the medical experience had been like. So it helped her not only to feel more understood and seen by her mom, but to actually move forward within her medical treatment so that it wasn't so terrifying for her.
Yeah, that's brilliant because there's really those two parallel benefits in the client experiencing the normalization or feeling understood and validated, but also the benefit of what I'm hearing there of really processing and working through the intense adverse experience.
Yeah.
It's often thought, I think, as a myth or a misconception that art therapy, is mostly for children, and people, do creative therapies mostly for children. Can you speak to that myth or misconception?
Sure. Yeah, I mean, I think that the arts are for everyone. I think we all have the ability to be creative. And I do think it gets lost. A lot of times we stop doing art in around second grade, or we have experiences that are traumatic within school where we're maybe shamed or made to feel like our art isn't as good. Um, but I really believe that art and using creativity is kind of this golden road into our unconscious of what's going on beneath the surface. And if we allow ourselves to use art to go there, we can really kind of go deeper into the work that we need to do to process whatever we're experiencing. I also like to tell my clients, I'll hear things like, oh, this is too hard, or maybe I notice their perfectionistic tendencies coming up, like it's not perfect, my circle isn't perfectly round. And I can use that again as a metaphor of like, life is hard, like what you're experiencing outside of our therapy office is messy and it's not perfect. And if we can sit with that feeling of it being uncomfortable, we can learn to sit with it outside of session two and allow it and work through it. So it's this great metaphor for life of like feeling into that discomfort and allowing it to be there and then moving forward anyways.
Yeah. And that's really brilliant. One of the areas, right, that I'm hearing there that people will often self-criticize is they apologize for their art. They say, "Oh, I'm so sorry, I'm not that much of an artist." And it's so common that we hear folks say, "Oh, I really don't do this." And they say that even before they've done anything. And it's like we're so conditioned to self-criticize in creative expression for what you're saying at a really young age.
Right, right, right. And you can point that out within the therapy session. Like, I notice you're apologizing for this. Does this happen outside of session when you feel like you've made a mistake or somebody maybe gives you a critique? Art therapy in general is a loose term, right? Like, we can play guitar, like you have guitars behind you. We can use the music as therapy. We can use movement with drumming. We can use like baking a cake and decorating a cake as our art. It doesn't have to be just coming in and learning how to do like a fine art technique like oil painting or acrylic painting. It's very, very loose and open to whatever the client is interested in. So I've had clients that are like, I want to learn how to sew. And so I'm like, yeah, we're going to learn how to sew today. Like, let's figure this out. Or like, I want to do stained glass. Yep, we're going to figure out stained glass. So it doesn't have to be, it can be something fun and light. It doesn't have to be like, a rigid, scary experience. And I would hope that like a good art therapist, a therapist willing and open to using the arts would be open to whatever the client is really wanting to learn.
Yeah, that's really beautiful. Again, people might just think art therapy as, paints and canvases, and
Yeah,
there's so much more to expressive therapies than just one form of art. That's
right.
really, yeah, that's really helpful. Something that, you said earlier, use the word unconscious, which, particularly not that expressive therapies are exclusively for psychodynamic therapists. But I think the psychodynamic folks, maybe their ears perked up when you said the word unconscious. Sometimes we think of art therapy or expressive therapies, and I'm sure you've encountered therapists who said, "Oh, I could never do that because I'm not an artist."
Oh, yeah.
Can you speak to that?
Yeah, yeah, yeah. Well, it's true. You cannot call yourself an art therapist if you haven't done all the hours of training. You can call yourself an expressive arts therapist unless you've also done that program. But art is open and available to all of us. And I think as long as you don't advertise yourself as an art therapist, you are fine to do it in a safe way. Obviously, like taking a class and learning from an art therapist is a great way to get started. And there are, within a class, you would learn things like there are certain mediums that are more fluid. They might produce more of, dissociative feature. So being mindful of what you're working with and how the different medias can affect your client is going to be really important.
Yeah. And the therapist doesn't have to, be a professional artist
No,
in order to do really robust and meaningful art therapy, as long as they have the appropriate training credentials, things of that nature, with the client.
right, exactly. Yeah.
Excellent.
Yeah.
Well,
Art is very forgiving in that, it's like even just like taking a collage, like get a magazine and tearing out pictures that feel like resources to you or to your client. And the other thing I would say, if you're not an art therapist, doing your own art as a therapist first and seeing how it makes you feel, and then saying this was really beneficial, and you can take that with you to your clients.
Yeah. Oh, that's really exciting just to think about how also, therapists as part of their own processing, they're working through countertransference or even their own self-care.
Right.
Can consider integrating expressive therapies into their own wellness.
Yeah. Yeah.
Yeah. Well, this has been really just exciting. It's amazing to hear from you, who, is an expert in the field in both of these areas and the integration of both of those things.
Mm.
So where can someone, a practitioner, a counselor, a mental health provider, how would they learn more about you, the work that you're doing, the intersection of art and
Yeah.
expressive therapies in EMDR?
Yeah. My website is a great place to start. It's just my name, jocelynfitzgerald.com. Yeah, and I have courses once in a while. And, I love to share my book is out. It's on the website and it's on Amazon too. So those are the website's probably the easiest place to get a hold of me.
Awesome. Thank you so much. So that's jocelynfitzgerald.com. And of course, we have continuing education courses, including your course, as well as other courses featured on allyacademynw.com as well. Jocelyn, such a pleasure talking with you today. Thank you so much for sharing your expertise. And
You're
I look forward
welcome.
to talking with you again.